Welcome back, everyone. 9:15 is the time on a Monday. Well, you've all heard about the sunshine vitamin. We're talking about vitamin D and the role it plays in building healthy bones and teeth. But vitamin D plays a role in other aspects of your health as well. And here to shine a little light on the topic is Dr. Kimberly Manning from Grady Healthcare and Emory University. Thank you so much for joining us.
My pleasure.
You know, I think a lot of people think that, vitamin D, I go out in the sun, spend some time, walk a little bit,
right?
I'm good.
Right.
And that's not the case. So talk to us a little bit about what vitamin D actually is.
Okay, so vitamin D is special in terms of vitamins in that it's a little different than others. Vitamins are typically nutrients and you can get them in your foods and everything, but the difference with vitamin D is that your body can actually make it. So it acts as a hormone too, and through sun exposure a process happens for you to make vitamin D. And you're right, most of us think that with a little bit of sun exposure in a place like Atlanta, that's more than enough to do the trick, but that really oftentimes isn't enough, and it's very difficult to get it in your diet.
And like you're saying, a lot of people are deficient in vitamin D, so who is actually at risk?
Yes, so the people who are most at risk are people who have darker complexions, so melanin, right? So it's going to be harder for that skin conversion to happen into vitamin D. People who, for cultural reasons, are on their jobs where their skin covered. Most of us are now meticulous about wearing sunblock.
Yes.
So sunblock is really decreasing that conversion. And then the elderly are people who don't eat dairy, because a lot of our dairy foods and things with calcium are fortified with vitamin D. And unless you're eating a liver and egg yolk diet, which none of us are, it's pretty tough to get it in diet.
And fish as well, right?
Yes, fatty fishes are a way to get it too, but the kinds of fatty fishes and the amount one would need, it's pretty challenging.
So how much vitamin D do we really need?
So it depends on your age. So if you are a baby up to 12 months, you need 400 international units. Most other people from ages 1 all the way up to 70 will need 600 international units a day. And then if you're an elder, 70 or greater, my mom will tease me for saying that, elder. If you're over 70, 800 international units a day. But for individuals who see their doctors and determine that they are deficient, they may have to take prescription level amounts, and that could be a higher amount.
And vitamin D is not just connected to just bone issues as well.
Right.
Some other things. Can you spread a little
It
bit of information on that?
and now there's lots more research about that. So we know that vitamin D and calcium work closely together. Vitamin D helps you absorb your calcium, and if your vitamin D is low, it can lead to like soft bones. But there's also very well described things which should be mentioned. Low vitamin D levels are associated with higher levels of colon cancer. There's also been research about the relationship between vitamin D deficiency and increase in dementia and cognitive deficiencies. And also it's well described as lower vitamin D levels being associated with multiple sclerosis. And the list goes on and on. Now I will say that the jury is still out, and there isn't clear research saying that taking high doses of vitamin D will make all of those things go away. But we do know that low vitamin D levels are something that are associated with quite a few bad health outcomes.
We just have a few seconds left. Do you want to give any closing remarks about vitamin D?
I think the closing remark is, do not assume that your vitamin D level is normal. Ask your doctor to check a level. If you take a supplement over the counter, that should be fine. But if your level is low, your doctor may need to give you a prescription strength vitamin D.
All right, I'm going to be checking.
Check it out.
All right, Dr. Manning, thank you so much.
Thanks for having me.
Time right now is 9.